is divided in, the muscles of the thigh are divided into three compartments. The muscles of the thigh are divided into three compartments: the anterior compartment, the medial compartment, and the lateral compartment. So I said that the thigh muscles are divided into three compartments. They are the muscles of the anterior compartment. They are muscles of the hamstring or posterior compartment, and they are muscles of the medial or adductor compartment. The medial compartment is also known as the adductor compartment because most of the muscles there adduct the thigh at the hip joint. The muscles of the posterior compartment are known as the hamstring compartment because they are long and they look like strings. And then you have the muscles of the anterior compartment. What am I going to do today? I'm going to outline to you the muscles, their nerve supply and action. And I'm going to leave for you the origins. Of course, the origins are indicated in the tables. But I'm going to leave to you those origins and insertions to help you study the bones because the origins are on bones. And I will examine them. Origins and insertions, you're going to go and look at them muscle by muscle. And if you look at these origins practically, they're going to help you to study the bones. So I'm not going to waste my time on the origins and insertions. I'm going to leave them to you. So the posterior compartment has three muscles: biceps, femoris, semitendinosus, and semimembranosus. Why do they call this muscle semitendinosus?
Because part of it is formed by a membrane.
Why do they call this muscle biceps?
Because it has two heads.
The long head and the short head. And you can see that the origin of the long head and the origin of the short head are different. So you're going to go and look at these origins. They are going to enable you to study the bones. The insertions are indicated here. This is the insertion for biceps. Both the long head and the short head come together and they insert in one position. And these are the insertions of the semitendinosus and semimembranosus. So these are the muscles of the posterior compartment of the thigh, and they are known as hamstring muscles. All of them are supplied by the sciatic nerve. But I want you to observe, the sciatic nerve is made up of a tibial portion and a common peroneal portion. So do not end at sciatic nerve, but which part of the sciatic nerve? All these muscles are supplied by the tibial portion of the sciatic nerve, except the short head of biceps, which is supplied by the common peroneal portion. They extend the thigh at the hip joint and flex the leg at the knee joint. These are the muscles of the posterior compartment of the thigh. Don't forget the origins and insertions. You can see the semitendinosus, the semimembranosus, and the long head of biceps. All of them supplied by the tibial portion of the sciatic nerve. You see their origin? That's their origin. And the biceps is inserting there, as indicated in the table, head of fibula. And the medial condyle receives attachments. Medial condyle and medial aspect of the proximal tibia receives an insertion of these two, semimembranosus and semitendinosus. The short head does not originate from the ischial-tuberosity, it originates from the posterior aspect of the femur. And you see that ridge from where it originates from, the linear aspera. So when they talk about the muscles of the posterior compartment of the thigh, these are the muscles. So when they are excessively stretched, for example, when you're kicking or running, these muscles can be excessively stretched, causing muscle strains, hamstring strain. when you're kicking or running, you can stretch them excessively and they tear. And when they tear, the blood vessels rupture and you get accumulation of blood in the posterior compartment, which is a hematoma. That blood remains in the posterior compartment because the overlying connective tissue or fascia prevents it from entering other compartments. And someone is going to sense pain in the posterior compartment of the thigh because of the tear of those muscles due to their strain. When they contract forcefully, the ischial tuberosity can fracture. They can contract forcefully and pull off the ischial tuberosity. And when the ischial tuberosity breaks off, as a result of the pull of this tendons of these hamstrings, we call that an avulsion fracture. An avulsion fracture is a fracture which is as a result of a tendon of a muscle forcefully contracting and breaking off piece of a bone. So when these muscles contract forcefully, they're going to break off the ischial tuberosity, and that's what we call an avulsion fracture of the ischial tuberosity. The muscles of the anterior compartment of the thigh are as follows. This muscle known as iliopsoas is made up of two. There's a muscle known as iliacus, and there's a muscle known as psoas major. So let me show you that. This muscle is known as iliacus, originating from the lumbar vertebrae. And this muscle is known as iliacus, originating from the iliac fossa. Psoas major from the lumbar vertebrae, iliacus from the iliac fossa. However, when these muscles reach the anterior compartment of the thigh, their bellies come together. And when their bellies come together, we call it iliopsoas. A belly of iliacus and a belly of psoas. That's why they call it iliopsoas, because they come together in the anterior compartment of the thigh. And they insert in the lesser trochanter of the femur as indicated in the table. So that is the muscle known as iliopsoas, made up of iliacus and psoas. Then there are these four muscles. These four muscles are taken together and they are known as the quadriceps femoris. The reason they are taken together is because part of their tendons unite. They are taken together because, number one, part of their tendons unite and they have the same action. Part of their tendons unite, they have the same action, and therefore they have the same nerve supply. Now, when parts of their tendons unite, it means that they have a common action. Rectus femoris. The origins are indicated here. You look into them, but you see it is inserting in the patella. Vastus lateralis is also inserting in the patella. Vastus medialis, part of it is inserting in the patella. Vastus intermedialis, each tendon joins the tendons of this muscle, especially the tendon of rectus femoris. So you're going to see that these muscles, parts of their tendons unite and insert in the patella. That is why they are taken together. And they have a common action of extending the leg at the knee joint. They extend the leg at the knee joint. Whenever you're sitting, you can even do that. You can extend the leg at the knee joint. Are you extending the leg at the knee joint? Then you're going to touch the muscles of the anterior compartment. You're going to sense them contracting. So these muscles, the quadriceps, extend the leg at the knee joint and flex the thigh at the hip joint. They extend the leg at the knee joint and flex the thigh at the hip joint. Which muscles? Rectus femoris, vastus lateralis, vastus medialis, and vastus intermedialis, muscles of the anterior compartment of the thigh, known as the quadriceps. The origins are indicated there. But you can see that patella is a common origin, it's a sesamoid bone. And then we have this other muscle known as sartorius. This is a long and oblique muscle. You shall see it originating from the anterior superior iliac spine and inserting on the medial surface of the tibia. This muscle flexes the thigh at the hip joint and also flexes the leg at the knee joint. The quadriceps extend the leg at the knee joint. The sartorius flexes the leg at the knee joint. The quadriceps flex the thigh at the hip joint. The sartorius also flexes the thigh at the hip joint. You can see all these muscles are supplied by the femoral nerve, except the psoas major, which is supplied by direct branches from the spinal nerves of the lumbar plexus. So this is what I mean. This muscle this iliopsoas is a muscle of the anterior compartment of the thigh. This is sartorius from the anterior superior iliac spine to the medial aspect of the tibia. And these muscles here are the quadriceps. This is rectus femoris. You can see its tendon here. Deep to this rectus femoris, if I remove it, deep to it we have what we call vastus intermedialis, this muscle. Vastus intermedialis. So this is rectus femoris. Deep to it is vastus intermedialis. Lateral to it is vastus lateralis. And medial to it is vastus intermedialis. Medialis. I come again. These muscles here are the quadriceps femoris. This muscle is known as the rectus femoris. Of course, we shall see that it originates from the anterior inferior iliac spine. This muscle lateral to it is vastus lateralis, originating from the lateral lip of the linear aspect. The muscle medial to it is the vastus medialis, originating from the intertrochanteric line of the femur. And deep to this muscle, you have the vastus intermedialis, originating from the anterior surface of the femur. The origins and insertions are indicated in the table. Parts of their tendons unite and they insert into the patella. And these muscles, the quadriceps muscles, extend the leg at the knee joint and flex the thigh at the hip joint. All of them supplied by the femoral nerve. So the iliopsoas, the sartorius, and the quadriceps are the muscles of the anterior compartment of the thigh. You can see the anterior inferior iliac spine giving origin to the rectus femoris. The vastus lateralis is there. It has attachment to the lateral lip of the linear aspera. And then the vastus medialis is here, having origin from the intertrochanteric line. Are you seeing that their tendon is coming together? That's why they call it the quadriceps femoris tendon. Part of it inserts in the patella, part of it inserts in the patella, and part of their fibers, part of the fibers of the tendon insert on the medial aspect of the tibia, and then part of the lateral aspect of the tibia. So the muscles of the anterior compartment of the thigh. And when you make a transverse section through the thigh, you're going to see our rectus femoris there. This is the rectus femoris. Deep to it is the vastus intermedialis. So the rectus femoris, lying deep to it is the vastus intermedialis. Then lateral to it is the vastus lateralis, and then medial to it is the vastus medialis. So that is why when the rectus femoris is in position, you do not see the vastus intermedialis, which is deep to it. And then the sartorius muscle is there. These are the muscles of the anterior compartment of the thigh, plus the iliopsoas, which does not reach this level. There is this small muscle known as articularis genus from the anterior surface of the distal femur. It attaches to the capsule of the knee joint. This muscle is very small. It just elevates the synovial joint when the knee is moving. So it's just a muscle which elevates the synovial membrane, the capsule of the knee joint, not the synovial joint, but it elevates the capsule of the knee joint. When it contracts, it elevates the capsule of the knee joint. That's why the capsule has to move in relation to the movement of the knee joint so that it's not excessively stretched. But the major muscles are the rectus femoris, vastus intermedialis, vastus medialis, and vastus lateralis, and sartorius. The tables summarize them for you so that when it comes to study them, they don't give you a hard time. Now, I want you to go, members, and read about the femoral triangle and understand it. Go and read about the femoral triangle. It's very important for you to appreciate. Now, there's a triangular region on the anterior aspect of the thigh, anteromedial aspect of the thigh. There's a triangular region. This triangular region is clinically important. How? Deep within this triangle, we have the femoral vein, the femoral artery, and the femoral nerve. The femoral vein draining deoxygenated blood from the lower limb, the femoral artery supplying oxygenated blood to the lower limb, and the femoral nerve supplying muscle of the anterior compartment. We also have lymphatics draining the lower limb. So deep to this femoral triangle, we have the lymphatics which drain lymphatic fluid from the lower limb. We have the femoral vein which drains the oxygenated blood from the lower limb. We have the femoral artery which supplies blood to the lower limb. And we have the femoral nerve which supplies the muscle of the anterior compartment of the thigh. Now, what makes it of clinical significance? Those contents which are located within it are only covered by skin and subcutaneous connective tissue. They are very, very important structures, but they are covered by skin and subcutaneous tissue. So they can easily be injured. On the other hand, they can be used for laboratory, for clinical procedures, not laboratory. They can be accessed and used for clinical procedures because they are near to skin. But on the other hand, because they are near to skin, they can easily be injured. So that is why this femoral triangle is of clinical significance. Any penetrating injury on the anteromedial aspect of the thigh can either injure the femoral artery, the femoral vein, and the femoral nerve, because they are only covered by skin. So this femoral triangle has a superior border, which is made by the inguinal ligament. This is the inguinal ligament. It forms the superior border of the femoral triangle. This is the medial border. This medial border is formed by a muscle known as adductor longus. It's a muscle of the medial compartment of the thigh. And this lateral border is made by the muscle known as the sartorius, which we have talked about as a muscle of the anterior compartment of the thigh. So you can see the inguinal ligament forming the superior border. This muscle adductor longus forming the medial border. And this muscle sartorius forming the lateral border of the femoral triangle. The roof, skin, and subcutaneous fascia. The floor, are you seeing the floor of this triangle? The floor is made up of this muscle iliopsoas and pectineus. These are the muscles which form the floor of the femoral triangle. And these are the muscles which form the boundaries plus the inguinal ligament. And what forms the roof? What forms the roof of this femoral triangle?
The skin and the subcutaneous fat.
The contents from medial to lateral. This is the femoral canal. What is the importance of the femoral canal? It is an opening through which lymphatics of the lower limb pass as they are draining the lower limb. Lymphatic drainage from the lower limb is taken by these lymphatic vessels which pass through that femoral canal to the abdomen and the pelvis. So the most medial part component of the femoral triangle is the femoral canal, which conducts lymphatics. From the femoral canal, we go to the femoral vein. From the femoral vein, we go to the femoral artery. From the femoral artery, we go to the femoral nerve. Those are the contents of the femoral triangle from medial to lateral. You can also mention them from lateral to medial, as long as they are in order. And the femoral vein and femoral artery, they are surrounded by a connective tissue known as the femoral sheath. Femoral sheath. So this is the femoral triangle. They can insert a catheter within the femoral artery and navigate it up to the arch of the aorta and inject contrast in the coronary arteries to outline them when they are making an X-ray of the chest. They can tap blood from the femoral vein for laboratory investigations, or they can insert lines there. Intestines, loops of intestines can herniate through the femoral canal and form a femoral hernia, which hernia can compress these blood vessels and compromise blood supply and venous drainage to and from the lower limb. So I've indicated you some of the clinical significances of the femoral triangle. You'll go and read about them. The femoral pulse means when I palpate the femoral triangle, palpating is to compress or to touch the roof. When you press the roof of the femoral triangle, you sense the pulsations of this femoral artery. And when you sense the femoral artery pulsating, it means that blood is reaching the lower limb. But if the femoral artery is not pulsating, it means that blood is not reaching the lower limb. Finally, the muscles of the medial compartment, we have this muscle pectineus. You remember the floor of the femoral triangle had a muscle known as pectineus. So this muscle known as pectineus, then adductor longus. Deep to the adductor longus, there is a muscle known as adductor brevis. And deep to adductor brevis, there is a muscle known as adductor magnus. And then the gracilis, as indicated in our table here. The muscles of the medial compartment of the thigh. Pectineus muscle, adductor longus, adductor brevis, adductor magnus, and gracilis. These muscles adduct. The muscles of the medial compartment of the thigh adduct the thigh at the hip joint. And all of them are supplied by the obturator nerve. All of them are supplied by the obturator nerve, with the exception of the pectineus, which has a dual nerve supply. Part of it is supplied by the femoral nerve, part of it by the obturator nerve. And this muscle adductor magnus, part of it is supplied by the obturator nerve, that is the adductor portion, which adducts. But part of it is supplied by the tibial portion of the sciatic nerve. So all of them are supplied by the obturator nerve, with the exception of pectineus, part of which is supplied by the femoral nerve, and then adductor magnus, part of which is supplied by the tibial nerve. But those muscles are supplied by the obturator nerve, with those two exceptions. They adduct the thigh at the hip joint, but this part of the adductor magnus, which is supplied by the tibial portion of the sciatic nerve, for it extends the thigh at the hip joint. So it is part of the hamstrings, because the hamstrings are the ones which perform these actions, and most of them are the ones which are supplied by this nerve. So all muscles of the medial compartment of the thigh adduct the thigh at the hip joint, except the portion of the adductor magnus, which is supplied by the tibial portion of the sciatic nerve, which extends the thigh at the hip joint. And because of this, it is taken to be part of the hamstrings. The origins and insertions are indicated here for you to study the bones. So you can see this muscle adductor magnus. When you go back to our table, adductor magnus, part of it originates from the ischiopubic ramus and inserts in the linea aspera. So this part of the adductor magnus is the one which adducts and is the one which is supplied by the obturator nerve. So this part from the ischiopubic ramus to the linea aspera, this is known as the adductor portion of the adductor magnus. It's the one which is supplied by the obturator nerve. Now, this part of adductor magnus originates from the ischiotuberosity and inserts on the medial condyle of the femur. So this part, which originates from the ischiotuberosity and inserts on the medial condyle of the femur, is the one which is supplied by the tibial portion of the sciatic nerve, and it is part of the hamstrings because it participates in the extension of the hip joint and is supplied by the tibial portion like the hamstrings. So we can see our adductor brevis as indicated in the table. Pubis, inferior ramus, pectineal line, and linea aspera. Pubis, pectineal line, and linea aspera. When you go to the adductor longus muscle, pubis, and medial lip of the linea aspera. And see, pubis and medial lip of the linea aspera. You're going to go to that bone. This ridge is the linea aspera. It has a medial and lateral lip. So you can see it coming from the pubis to the medial lip of the linea aspera. And then we go back to that muscle, the pectineus, pectineal line. When you go back from the pectineal line of the hip bone to the pectineal line, as you see it, pectineal line of the femur. And then we go back to our muscle known as gracilis, from the pubic ramus to the medial aspect of the tibia. From the pubic bone to the medial aspect of the tibia. So those are the muscles of the medial aspect of the medial compartment of the thigh. So we have looked at the muscles of the anterior compartment of the thigh, the posterior compartment of the thigh, which are the hamstrings. The posterior compartment of the thigh is also known as the hamstring compartment, made up of semitendinosus, semimembranosus, biceps, femoris, which has a long head and a short head. And all those muscles were supplied by the tibial portion of the sciatic nerve, except the short head of biceps, which was supplied by the common peroneal portion. These muscles of the posterior compartment extend the thigh and the hip joint and flex the knee joint, flex the leg and the knee joint. The muscles of the medial compartment, pectineus, adductor longus, adductor brevis, adductor magnus, and gracilis. Those muscles adduct the thigh, the hip joint. All of them are supplied by the obturator nerve, with the exception of the adductor portion of the adductor magnus, which is part of the hamstrings. Then the anterior compartment of the thigh, we saw iliopsoas and the quadriceps, iliopsoas, the quadriceps, and the sartorius muscle. Iliopsoas, the quadriceps, and the sartorius muscles. The quadriceps flex the thigh and the hip joint and extend the knee joint. Sartorius flexes the thigh and the hip joint and also flexes the leg and the knee joint. And then the iliopsoas participates in the flexion of the thigh and the knee joint. All of those muscles of the anterior compartment were supplied by the femoral nerve, with a few exceptions like pectineus, which is supplied by both the femoral nerve and the obturator nerve. So I want you to go and look into those muscles, look at their origins and insertions,